today the hospital employs some of the most qualified and competent human resources, supplemented by world-class technical expertise, and that this hospital will offer specialized programs in cardiology, oncology, neurosciences, advanced critical care, diagnostics, as well as responding to the increasing burden of non-communicable diseases in Tanzania. These services come in addition to our traditional key focus areas of maternal, neonatal, and child health, which have also been strengthened as a result of this expansion, the Phase 2 building. I'm delighted that this advanced facility will allow all Tanzanians to receive world-class treatment at home, and therefore reversing the need for medical tourism abroad, and hopefully encouraging medical tourism within the region.
Yali Madat, welcome, bienvenue, and Happy New Year. Thank you for tuning in to another Friday Night Reflections. My name is Safiqa Kara, and I'm honored to welcome all of our Jamati members, multi-faith family members, and everyone tuning in from across the globe. I'm coming to you from Calgary, and it is such a pleasure to be hosting tonight's episode. It's been an exciting couple of weeks for me, and many of my colleagues as well, as I think we've all breathed a sigh of hope. Myself and many members of our frontline teams have received our first dose of the COVID-19 vaccine. We are grateful to have taken our first steps to protecting those who we care for and are now better able to help those in need. As a frontline provider at Generations Community Housing Project in Calgary, I'm also very excited to share that our residents received their first dose of the COVID-19 vaccine on January 13, 2021. I wish you could have all been there with us on that day. It was magical. The residents were excited and anxiously awaiting as we made our way through the building, vaccinating each one. We were received at each room with a smile, followed by a little cringe because who loves a needle? And then a big thank you. Our residents have been isolated from their families and loved ones for 9 months. January 13th was the day they began to see the light at the end of this COVID tunnel. I feel very fortunate that our entire Generations community has received the first dose. With this vaccine, not only do we protect ourselves, but we protect each other. As our team and residents here at Generations have received our first dose of the vaccine, we anxiously await our second dose in the middle of February. According to studies, we can all look forward to full protection that the vaccine provides with 95% effectiveness within 3 weeks of our second dose. As you know, COVID-related illnesses have been devastating for long-term care homes across the country, and I'm so pleased that we have been able to protect some of our most vulnerable members of society. In case you're wondering, it was super easy to get the vaccine. I had no side effects other than a mildly sore arm for a day and a Mickey Mouse Band-Aid as a reminder. Inshallah, we will all get our chance to get vaccinated soon. And now let's take a look at the program tonight. Our focus is on the Aga Khan Health Services response to the pandemic. As someone who has worked in Tajikistan with AKDN, I can appreciate the works of the AKHS and some of the health challenges faced in other settings. With my work with AKHS in Tajikistan, I got to experience firsthand the multifaceted approach taken by the AKDN to strengthen healthcare systems. This included education and supportive training for local health providers, including nurses, doctors, lab technicians, as well as community health promotion, vaccination programs, primary health clinic supports, dental clinics, hospitals, and diagnostic centers. Together with local governments, the AKDN and AKHS were able to improve the access of quality healthcare to all, despite isolated and mountainous conditions. We will start off with some words from Council for Canada President Ameerally Kassim-Lakha in his second installment of From the Heart, in which he speaks to the soft skills needed to succeed in today's world. Please welcome President Amir.
My dear brothers and sisters, Yalimudat. Tonight is the second discussion in our series, From the Heart, where each week we discuss one character trait crucial to success in today's world. Last week, we spoke of agency, our willingness to embrace change and take control over life outcomes. For our second conversation, I will discuss the importance of having vision, setting the right goals, and the planning we must undertake to make them a reality. Let me start by explaining the importance of establishing future aspirations. We set long-term goals because they give our lives meaning. They tell us how to focus our efforts, make decisions, and organize our time. Life is long and filled with surprises. Our aspirations are a North Star, giving us a sense of direction so we don't get lost on our journey. It is very easy to lose sight of the future because we are preoccupied responding to day-to-day life circumstances, the daily problems of life. To develop vision, we have to picture ourselves, our children, and our future generation over a horizon of 10, 20, 50 years, and consider all the dimensions which bring meaning to our lives: family, friendships, career, business, faith, and community, because each of these is important. What does success mean for us in each one of these dimensions? If we are having difficulty visualizing our future, or we need inspiration, we can draw from examples around us. We can look to friends, mentors, and other role models, consider the lives they have lived, and analyze and assess the steps they have taken to achieve successful outcomes. In doing so, we can begin to put together the pieces of the puzzle that will form our life picture. Setting goals is a high and serious endeavor. It is the story that our children and grandchildren will learn about us, the outcomes that will endure beyond our time. Our vision, therefore, has to be ambitious. As we think of our goals, we have to push ourselves to think higher and higher. Think of the highest of aspirations, those that we can barely imagine coming to fruition. I'm not saying be unrealistic, but we are speaking of the purpose of our lives, and so we have to set our sights high. We have to be positive, establish a positive picture that we can work towards. How do we then bring our long-term aspirations to life? We can have the greatest of ambitions, but how do we execute against these goals to turn them into reality? We can start with the broader vision and systematically walk back step by step. In doing so, we create a plan of action, the decisions and intermediate links between our current circumstance and our end result. In most cases, it is not possible to get directly from A to Z. Rather, we have to take incremental steps and build on a foundation. In thinking through our plan, we can draw on the experience of other people who are on this journey. There are people on the same path, much further ahead. They have been on the path already. Seek their wisdom and guidance, because doing so accelerates our trajectory. It clarifies misconceptions in our mind and ensures we do not make the same mistakes. This is where role models and mentors become important, and is our reason for establishing the Fast Track Mentorships program. Remember also that it takes time to realize our objectives. We may look at others who have achieved great success and ask how we can achieve the same. Success is built over time and not overnight. The outcome that we observe in others is just the tip of an iceberg of hard work, mentorships, setbacks, perseverance, agency, and planning. Let me give an example. Suppose we want to secure admission to distinguished educational institutions. Admission to top programs is unattainable without years of foresight and preparation. If we don't give ourselves enough time to prepare, to ready ourselves for the moment when we need to apply, the window of opportunity will be closed to us, no matter how strong our raw intellect or other natural qualities. And when someone is successful, we are seeing the tip of the iceberg of how hard they have worked to achieve that success. So, I encourage our youth to think carefully about our daily life and whether we are in control and whether we are planning and visioning carefully. When we think of our most valuable assets, we often think of our possessions and treat them with immense care. But we seldom apply the same intentionality to our most precious asset, our time. We treat our time as though it is endless in supply, spending it on causes that don't move us forward. Our long-term aspirations have to factor into how we spend our day-to-day life today. Our aspirations and actions have to align. They have to connect. Otherwise, we cannot move forwards towards attaining our aspirations. Therefore, I say to our youth, take a structured, methodical approach every single day. Be regimented with your time. If you need to think through your goals, prepare for a unique opportunity, or cultivate a special relationship, carve out blocks of time to ensure that you attend to these priorities. By taking control of the minutes, you take control of the hours and days, the months, and then the years. My dear brothers and sisters, in the gift of life that we have been granted, we have also been given an opportunity to work towards achieving an exalted destiny. Our beloved Imam has guided us to set strong, ambitious goals, to remember that our time on earth is limited, and therefore to act with purpose and to the best of our abilities. The goal of tonight's discussion was to provide a structure for doing this, and to think hard about what we want to make of our lives so that we can turn our vision into reality. Thank you and Khuda Hafiz.
Thank you so much, President Saib, for sharing those thoughts with us. Tonight, we are privileged to have join us Dr. Gijs Walraven, Director of Health for AKDN. I was fortunate to speak to him last week. We start off with a short video describing the work of AKHS during the pandemic, narrated by Dr. Walraven, followed by my fascinating earlier discussions with him. Dr. Gijs Walraven is Director for Health at the Aga Khan Development Network, the AKDN, and is based in Geneva. Dr. Walraven is also Honorary Professor in Community Health Sciences at Aga Khan University. Dr. Walraven joined the Aga Khan Development Network in 2003. Before this, he worked for a period of 15 years in Africa in healthcare provision, management, and research, with a major emphasis on district health systems. Dr. Walraven has published in more than 120 papers in internationally peer-reviewed journals. He's also author of Health and Poverty, Global Health Problems and Solutions, which he received first prize in the category of Health and Social Care in the 2011 British Medical Association Annual Book Awards. Please welcome Dr. Walraven.
We are living through an unprecedented time in our history as a global community. Many of us have found ways to live a new normal as the COVID-19 pandemic continues to spread around the globe. But we are the lucky ones. The reality is that for many people who are living in rural settings or slum areas of Asia and Africa, in impoverished communities, and in communities with poor health infrastructure, the COVID-19 outbreak is taking a significant toll. A vast majority of the world's population and the Ismaili Jamat are facing tremendous difficulty in coping with COVID-19, and helping these individuals has been a core priority for the Aga Khan Development Network and Jamati institutions. National councils and AKDN agencies are working closely to ensure a broad response to the pandemic. Together, we have provided support to roughly 3 million people and 600,000 families around the world. And while every part of our ecosystem has a role to play in the management of this crisis, our health institutions are especially critical at this time. At Aga Khan Health Services, we have engaged our network of 377 health centers and 14 hospitals in 3 key ways. 1. We have focused our efforts on raising awareness of COVID-19, with an emphasis on how to prevent becoming infected and how to prevent the further spread of the virus across our communities. In some countries, such as in Afghanistan and Tajikistan, this has meant that our community health workers and volunteers are going from household to household to provide information. 2. We have built both physical and technological infrastructures to provide care to the community. Partnerships like the one between Aga Khan Health Service Pakistan and the government of Gilgit-Baltistan have allowed us to open a coronavirus response site focused on COVID-19. We have also launched Virtual Doc, telemedicine services through a partnership between AKHS and the Aga Khan University to provide care to our communities remotely. Free telehealth consultations are also being offered in Dushanbe, Tajikistan, where our own health staff infection rates required us to temporarily close our community health center. 3. The Aga Khan Development Network's Digital Resource Center in Karachi has developed the Corona Check app, which helps to screen for symptoms at home to support patients and healthcare workers and to ensure that health facilities can focus on patients who need advanced care. In addition to these efforts, our broad network of agencies are also playing a critical role in our fight against COVID-19. I want to make special mention of the critical work being undertaken by the national councils with the support of focus to provide urgent humanitarian assistance, particularly food, medicine and shelter, to those who are suffering from the severe economic consequences of this pandemic. While our agencies have been working tirelessly to meet the needs of the community, the true heroes in this fight have been the Jamati members, the National Council volunteers, as well as AKDN staff and volunteers who have put themselves on the front lines of this crisis. It is the doctors, the nurses, the allied health professionals, the emergency personnel and the network of volunteers who have taken the management of this pandemic upon their shoulders. We honor and commend these heroes for their significant and continued efforts, often at great personal cost. As some countries relax their community quarantine measures and while others begin their lockdowns, I have just one simple message for the Jamat. Please continue to practice physical distancing and to limit your social activities outside your home. The last few weeks have not been easy as we have had to self-isolate. It is difficult to stay physically apart from friends and family, but it's also the best thing you can do to protect your loved ones. Shukran, Shukriya, Dhanyavad, Asante Sana, Tashakor, Spasiba, Merci, Obrigado.
Well, thank you for joining us today, Dr. Gijs Walraven. It's nice to speak to you again after many years. It's been a pleasure working with you in the past, and I'm happy to speak to you today. And today, I really wanted to take the opportunity to ask you, how is this pandemic affecting some of the populations in which Aga Khan Health Services is working and the broader network is working?
AKHS has been and continues to work in a number of countries in Central Asia, South Asia, the Middle East and East Africa. And we work in many circumstances really with relatively remote, vulnerable populations. And we saw this happening. We saw what was happening in Wuhan, then Italy, then other countries in Europe, in North America, the US, Canada. When it comes to our health systems, we had to adapt them, and we learned a lot. We learned a lot from our colleagues in the North or in the West, including the Ameerally health professionals in Canada, who we engaged, as well as from other countries. And they were learning, they were seeing and were really experiencing what was happening in their own countries. However, you need to realize that the health systems are very different from the Canadian situation, and you know this. But when it comes to that, we really had to prepare and, for instance, get in place protocols, but also to ramp up our capacity to deal with severe and critical patients. We have always had a focus on community health, primary health care, and increasingly over the last decade also secondary and tertiary health care. But in a number of circumstances, especially in the rural areas, those rural hospitals really did not have much capacity if it comes to dealing with severe and critical patients. And we had to put that in place. So if it comes to the ventilators, if it comes to the oxygen, if it comes to treatment like dexamethasone, again, learning from elsewhere, we were able to adapt and adjust. Similarly with testing, in many of the areas and circumstances and places where we worked, we didn't have that testing capacity, especially if it comes to the gold standard RT-PCR, as it is called. And we're putting that in place. And obviously, like I think the whole world, we were not prepared for the scale of what was coming towards us. But I think now, obviously we're not there yet, but we are in a much better position than we were, let's say, 9 months ago.
You spoke of, some of the different challenges that you have in contexts that are outside of the North American or Western Europe settings. Could you elaborate on maybe some of the specific challenges that AKHS has had in approaching this virus?
When it comes to supplies, equipment, personal protective equipment, including the gloves and the masks, etc., we were scrambling in the beginning. As you know, everybody tried to purchase this, and in a way that was not easy in the context that also high-income countries, the wealthy in a way, countries, were trying to purchase this as well, and prices went up and there were shortages. And to overcome that, we had to do a lot of work to ramp up and get ready. We were greatly supported by something which has been existing within the Aga Khan Development Network for a longer period of time. We have a specific mechanism to do what we call group purchasing, as well as the global networks which we have helped us to overcome some of those challenges. When it comes to marginalized populations, indeed, you can imagine that this goes back to the promotion and the prevention. It is very easy for us in the North or in the West to think about avoiding crowding. But if you're working and living, let's say, in poorer socioeconomic situations, in a Mumbai, in a Karachi, in a Dushanbe, in a Dar es Salaam, those kind of things are much more difficult to overcome and to think about. And especially in the West and also in Canada, you have social networks, social protection mechanisms. And social protection mechanisms in many of the circumstances where we work are not available. So if you think about being a daily wager and having to go out to make your daily living, and at the same time to think about protecting yourself and prevent that you become infected, those kind of things are extremely difficult to realize.
How is AKHS planning for the release of vaccines to countries in which Aga Khan Health Services operates? And how will that be rolled out, or when do you foresee that being rolled out?
Safiqa, if I might want to make one step backwards, and that goes about the response which AKDN has had around the pandemic. And it really was based on 4 pillars. Pillar 1 was related to health promotion, disease prevention. The second one was the sort of health response, so the medical response, making sure that the staff was trained, that we had the PPEs, that we had the equipment and the supplies. Number 3 was really supporting the Jamat if there were issues around what you could call humanitarian aid, if ensuring that they had food, that they had medicines if they had to purchase them, so if they had to pay the rent and couldn't afford it. So really supporting the Jamat to get through the crisis. And then the 4th pillar, and that is going forward extremely important as well, is the general development issues. So how do we address education? How do we address continuing livelihood? So in a way, something which is completely normal in, let's say, Canada, if it comes to social protection mechanisms, that somehow we try to help in that regard as well, the populations which we serve. I think if you don't do that, then you really are putting people in a very difficult position, because it's so difficult then to deal with the pandemic if you don't address the wider agenda. To come back to the vaccine question, vaccines are becoming available, but vaccines are becoming available at the moment only in the high-income countries. Again, Europe, North America, including Canada. And before we started the interview, Safiqa, you told me that you're going to vaccinate after this interview the members of your elderly home, which obviously is very great to hear. When it comes to the low and middle income countries, unfortunately, we are a bit behind. There are only a limited number of vaccines available at this moment in time, and they are not ending up, as we see it, in the countries in which we work. They might become available, but it will be later on. And what is very important is that we all think about and try to see how we can support equity in vaccine distribution. Unfortunately, we are seeing something which you could call vaccine nationalism. And it's understandable. Populations are worried and politicians react to that worry and want to help their own populations to get access to vaccines. But what we really need is that priority groups are served in an equitable manner all over the globe. So that means indeed the frontline workers, including the healthcare workers, but also others who are doing really the frontline work in response to the pandemic. It means the elderly, it means those with underlying conditions, so that they are becoming better protected, which helps us a lot to avoid also the overcrowding in our health systems. And the health systems are vulnerable, as we see in high-income countries, but they're much more vulnerable in the low and middle-income countries, including the countries in which AKDN works. So that's really something which is extremely important, that we get equitable access to vaccines around the globe. Canada is supporting the mechanism which is called COVAX. And COVAX is a mechanism which has been put in place by the United Nations and includes, for instance, the World Health Organization, but also the global body which looks after vaccination, the normal routine vaccination against measles, name it. And that is an entity called Gavi. That entity has been established with the support of the United Nations, of a number of countries, by foundations like the Gates Foundation. And that mechanism tries to ensure that by the end of 2021, 20% of the global population, which are the high-risk groups, is going to be vaccinated. And that has also been signed up in that agreement around COVAX by the 92 lower middle income countries. And that includes all the countries in which AKDN works as well. We are trying to align with that. And that is a major emphasis of what we try to do.
And Gijs, you spoke about so many things in that last response. There is kind of a global brothership or partnership required with COVAX to ensure that there's equitable distribution of the vaccine across the world. We are privileged in Canada to have had that opportunity at our site specifically already. You mentioned in your last response that, the healthcare systems are overwhelmed. We see that to some extent in Canada. And you mentioned how that's exaggerated or even a bigger challenge in middle and low income countries. How can we, as the Canadian Jamat, better support the work that Aga Khan Health Services is doing in many of these middle to low income countries? And how can we support currently during the pandemic in its active phase as we move through various waves? And even after we move through these waves?
I think what is very important is that if you are called to be vaccinated, that you go for it. The vaccines which have been approved in Canada are safe and efficacious. So when you're called up to be vaccinated, it's extremely important that you go for it. We need to all be vaccinated, or at least a large proportion of the population needs to be vaccinated to get rid of this pandemic. That's the bottom line. When it comes to how the Jamat could help us, the Canadian Jamat, there have been already some great initiatives. We have had great support from the health professionals all over the world, including from Canada, who have been advising and helping us. And also, really, if it comes to individual hospitals, they have had great support in, for instance, being able to discuss cases in our hospitals and getting input from those Canadian health professionals how to deal with certain situations in relation to severe and critical care for COVID patients. That engagement goes further. We are getting a great support and have established at the global level experts related to, for instance, testing, related to vaccines, related to therapeutics. And those global bodies are advising us and helping us to come up with the right solutions for the Jamat in the countries in which AKDN works, so the lower middle income countries. One other thing is we have had great support if it comes to moving the whole agenda and responding to the pandemic from the Jamat via what is called the Pandemic Fund. And that really has helped us over the last almost year now to respond and getting the financial means as well to do the right thing. And we will need more of that going forward, also as we start working on the vaccines. When it comes to the vaccines, we are developing vaccination implementation plans for each of the geographies in which we work. And there is a major difference when it comes to this vaccine. We are used to vaccinating, let's say, children or vaccinating pregnant mothers. Now we need to think about vaccinating priority groups which are very different. So we need to adapt the way how we vaccinate and how we go around it in the geographies in which we work. Developing these vaccination implementation plans helps us also to engage with the government. It is the governments who are deciding which vaccines they authorize and which they allow to get into those countries, in their own countries. They're in control. We're trying to help governments to preparing and go and ensuring that the vaccination can happen and that as many people participate in those vaccinations to overcome indeed also something which is common all over the world, but which needs to be addressed around vaccine hesitancy. So people who are really a bit reluctant to go for the vaccination. And it's understandable, it's a new thing. However, I can assure you that the vaccines which are being authorized and which are coming through at the moment are safe and efficacious. And if we want to overcome the pandemic, and it doesn't know borders, So if we want to overcome it at the global scale, we really need to help each other. So I end where I started in my response on the vaccines. If you have a chance to be vaccinated and you're called to be vaccinated, go for it.
You're right about that hesitancy, and we really do need to kind of take that approach of this is the only way that we will kind of be rid of this pandemic or move past this pandemic. Gijs, I just want to elaborate on one point that you mentioned. You know, the Aga Khan Health Services has quite the reputation for excellent vaccine rollouts in countries when it was, you know, dealing with either whether it was polio or diphtheria, any of those routine vaccines. I know firsthand with working with the program in Tajikistan that there was a huge absorbency when Aga Khan Health Services, you know, promoted it and applied, you know, a strategic approach to ensuring that all children got the vaccines at the appropriate age. If they had been missed, there was mechanisms for them to go back and get those vaccines. So I have no doubt that, you know, with the rollout of the COVID vaccine, Aga Khan Health Services has the experience and the wealth of knowledge to, you know, help countries execute this appropriately once they've been approved or accessed by those countries.
Just to add to what you're saying, Safiqa, on an annual basis, AKHS gives around almost 2 million vaccinations per year. In our early estimation, to address the issue in the priority groups in our core geographies, we probably need slightly more than 6 million vaccinations to be done. So it's also something for us clearly to think about. I think indeed you're correct in saying that we have a lot of experience in vaccinations, but we also will need to scale up, and that process of thinking that through and engaging the authorities and our partners at this moment in time is extremely important.
Yes.
The Pfizer vaccine needs what is called a deep cold chain. So you really need to keep it extremely cold. You're talking about freezers of minus 70 degrees Celsius. You can imagine that if it comes to the circumstances wherein AKHS functions, that almost always will not be feasible. So we will need vaccines which can be kept in a normal fridge, which already limits the number of vaccines which are available for low and middle income countries and needs to be thought through. The other thing which is important is most of the vaccines under development, you need 2 doses. And it really would be so helpful for the circumstances in which we work that we could do it with 1 dose. What we also need to realize if it comes to vaccines, that vaccines might not sound to be that expensive if it comes to Canada or high-income countries. But a vaccine that costs $10 per person for some of the countries and situations in which we work is more than the expenditure per capita per year in health. And that's something which also needs to be addressed.
You make an excellent point in both the availability, the ease of use of vaccines, and the cost per capita for these vaccines. All inhibit extra challenges in rolling out this vaccine in some of the countries in which Aga Khan Health Services works. You know, when we did vaccinate generations, we had several nurses come in with large freezer bags. Temperature controls are monitored, you know, every 15 minutes. We have light shields to keep the vaccine safe. It is administered in small quantities to the residents so that we're not wasting vaccine. All those logistical challenges are amplified in some of the countries because there is a lack of, as you mentioned, sometimes infrastructure to support that.
Perhaps one last point, and that's related again to vaccines, and specifically Canada. Canada has pre-purchased per capita more vaccines than any other country in the world. And it is quite likely, it is almost certain, that it will have too many vaccines. I really hope that there can be, that we can advocate for Canada to gift those vaccines via the COVAX mechanism, and that some of those supplies then also end up in the countries and in the geographies where the Jamat and its neighbors are living.
Gijs, can you tell us about perhaps the most difficult moment in this crisis for you or for Aga Khan Health Services?
Safiqa, the most difficult moment, I think, for myself as well as for our team was the first hospital which was really saw a surge of cases was the Aga Khan Hospital in Dar es Salaam. And the numbers really increased very rapidly. People came very late to the hospital, died in accident in emergency or shortly after arrival. So they came very late, and we had to do a lot of work about reinforcing both with health professionals, primary care, physicians, nurses, as well as the general audience to come earlier. But we were really struggling, and the most difficult moment for me was when we had the first staff member, the head of our outreach health facilities in Tanzania, a young man, 42 years old with a family, dying himself of COVID in our hospital, and the distraught of the staff, and then how to deal with that and to encourage the team and the staff of the Aga Khan Hospital to cope with that really was quite something, and we all felt personally affected by it. Obviously that was very tragic, but I also think we came stronger out of it. I think the Aga Khan Hospital Dar es Salaam has been helping us then to move forward in the protocols, in their experiences. And we had a lot of support again from the health professionals in dealing with this first wave in one of our facilities from other parts of the world, including from Canada.
I'm sure there have been other moments of pride and moments of accomplishment within the last, year, 8 months. How could you share one of those moments?
I want to give you one example. This is indeed, I would say, quite exciting. I'm talking now about Buni in northern Pakistan, high mountainous area, difficult to reach, a bit comparable to, let's say, Gorno-Badakhshan in Tajikistan.
Yes.
We had a program which was indeed with a strong base in community health and primary health care. Over the last 10 to 20 years, we have been establishing secondary health care in the small town of Buni, which is the capital of what is called Upper Chitral, with a large Jamati population. We did not have the capacity to deal with severe or critical cases there. However, we started preparing for that in April, and by July we had, you could say, a good deal in place. We were able to get in to ensure that we had the ventilators, to ensure that we had the treatment protocols, that we had the oxygen supplies, that we also had special wards for moderate patients, especially moderate patients with underlying conditions, so that if something would happen and they would become more severe, that they could be transferred easily to the unit which can deal with more severe cases. We got admitted in Buni Health Center, who was truly 103 years old, a carpenter. And that 103-year-old man was able to survive. He had moderate COVID. It took him almost 10 days to recover and to be discharged. He made it in the New York Times, and that was something we were all extremely proud about.
And certainly a moment to be extremely proud of your team and all of the accomplishments of Aga Khan Health Services.
We are in this, and I've said it before, it started as a sprint, but it has become a marathon with the speed of a sprint. And we still have a difficult period to come over. It's not going to finish, this pandemic, in the coming weeks. It will take time, and we need to get through this all together. And I think we can do it all together. We will do it all together. But it also has learned me that if it comes to our work and how we have done I'm really proud of our teams and how we have reacted as AKDN, as a Jamati leadership. And you can see that back in the data which we have, is that when it comes to the Jamat, if it comes to the number of infections, if it comes to mortality rates, that we're doing pretty well compared to other similar circumstances in our different geographies. So, yeah, there's more work to be done and there will be difficulties, but we're going to overcome this.
For sure, and it started in a sprint and it's a marathon that the Aga Khan Health Services is conquering and still running and will continue to run, I'm sure, until it reaches the finish line. And hopefully we as a Canadian Jamaat will be cheering and pushing along as needed and supporting wherever we can in that endeavor.
And perhaps one last point, and it was His Highness who helped us here, as he always helps us here. But in this case, we were thinking about a COVID-19 fund and response. His Highness said we need a pandemic response. And he's completely correct. And what I think one of the other advantages is of what has happened over the last almost now 1 year is that we obviously are dealing with COVID-19, but we will be much better prepared for future other pandemics as well, which will eventually also come. We can't deny it anymore.
We've seen throughout the pandemic that there's been a differing level of morbidity or mortality, or some would even say suffering, in the Western world compared, or in high-income countries compared to those middle and low-income countries. Have you come to thoughts on why that may be, and is that still the case? Globally, do we have a better understanding of why that may be occurring?
That's not an easy question to answer. First of all, many of the low and middle income countries have a younger population, so the demographics is different. Another factor could be that those who are there have less underlying conditions, especially the non-communicable diseases. They might also be more used to having communicable diseases, and with that have, in a way, a good developed immune response. In a number of circumstances where AKDN works, we work, for instance, in Central Asia, mainly in high mountainous rural populations, and crowding there is less of an issue than, let's say, in the slums of Mumbai or the crowded areas in, let's say, Kabul or other big cities. But in addition, there has also been certainly a theory, and it is difficult to prove, but the idea that living in high mountainous areas might be protective, because populations who live in high mountainous areas are used to lower oxygen levels, and their physiology, their body, including the production of what is called hemoglobin, and this is perhaps a bit too technical, but the physiology and the way how the body reacts has been adapted to circumstances that you might have lower oxygen levels, which is a major problem with COVID-19, and perhaps that could help them also then to survive. The last one, obviously, which is becoming more and more clear as well over the last number of weeks, is air pollution. In the high mountainous areas of Central Asia, Safiqa, as you know, air pollution is not a real problem, but it is a major problem in, let's say, Delhi or Mumbai. So there you see indeed that air pollution, we know now, contributes to certainly more severe disease related to COVID as well. And perhaps one additional point, Safiqa, and that is low and middle income countries, especially those in sub-Saharan Africa and in Asia, they are used to communicable diseases, they're used to outbreaks, so they're also more used to respond to that, I would suggest. While we in the north or the west might have forgotten that. So that is certainly also another factor which is important and we need to take into consideration.
I think that's an extremely important factor, and something I think even I didn't think of, and I'm sure many of us around here didn't think of, or take for granted on a daily basis. but things that have certainly been brought to light because of the pandemic.
Thank you, Safiqa. I enjoyed this.
As did I, Gijs. It's been a pleasure speaking to you again. I can say I tremendously miss the team, and it's been an honor to be able to speak to you today. Thank you so much for joining us, Dr. Walraven. We'll be cheering on your work and thinking of all of you as the AKDN helps to bring vaccines to the other parts of the world. And on the topic of supporting the global Jamat, we now take a look at the work done by some of our healthcare professionals supporting populations around the world in offering their time, skills, and knowledge. I hope you enjoy it.
During my Golden Jubilee, Smileys from around the world volunteered their gifts, not only of wealth, but most notably of time and knowledge in support of our work. We established a time and knowledge framework, a structured process for engaging an immense pool of expertise involving tens of thousands of volunteers. Many of them traveled to the developing countries as part of this outpouring of service. Their impact has been enormous in helping us to achieve best practice standards in our institutions and programs.
We created healthy food and meals and eliminated use of sodium, sugar levels, and fat content in meals throughout the campus.
The monies that we saved from efficiency and purchasing better and in utilizing ingredients much better, that money can go to patient welfare. So it would help patients who would otherwise not be able to afford the care, but in this way we can now support more patients than we were able to do previously.
I felt that coconut water was better. Kenya had no recycling program, so we did not know where to put these plastic bottles. And the coconut water had nutritional benefits. It also helped with the local economy. I went to a street in Mombasa and got a coconut seller to come to the school with hundreds of coconuts. That improved his lot in life.
Tajikistan has also adopted a new profession called a family nurse. So in many of the rural areas, they don't actually have a doctor, but they have a trained nurse who understands many of the concepts of family medicine and some of the common illnesses that come. And they actually deal with patients. And only when they think they can't deal with something, they send them on to the next larger town or city to get treated there. When the family medicine program was started, there was a full renovation done for all these facilities. New equipment was bought, new supplies were brought in. Physicians and nurses were retrained as family doctors and family nurses for 6 months, usually in Dushanbe, the capital city, and then brought back. A complete new medical record system was established, and then the patients started being seen. What I get out of this is simply the fact that when I look around the clinics and I see the enthusiasm, the positivity among the doctors, how excited they are that they are now doing a good job, a better job. Some of the younger doctors I've asked, and they say that we feel excited that we are able to see people of all ages, and that gives us variety in our care. Some of the older doctors, I distinctly remember one doctor who said to me, "Listen, I only looked after women and I'm not going to change, so don't even try." And that doctor today now sees men, and she has started seeing children. So that's exciting, that's good to know. On the other side, when you look at the community, it feels good to see that people have the confidence and they go to these family medicine centers.
What do I get out of it? That's a tricky question. But it gives me that upliftment, right? It gives me that satisfaction. Yes, I did something. Whether, if I train somebody, it's not just that person who is going to be capable. It's me too, that I have given my knowledge to somebody. I was in a position to give it and I gave it. So that's what I'm getting from it. And not only that, But it's also that now I've done my service to the Imam. If I have my strength in my area, I have weaknesses in other areas, like local language, local culture. So you have to be willing to accept that as well, and to take that with you as well, and to take the friendship that you have created.
Congratulations to all those health professionals who have served locally or globally and supported our brothers and sisters of the Jamat and elsewhere. Having had the opportunity, I know that this is both an act of service as well as one of self-growth, or enlightened self-fulfillment, as Hazrimam puts it. And now we have the first of a series of segments called COVID Conversations, in which we address questions that have been raised by Jamati members about COVID or the vaccine. As we all know, the COVID virus continues to surge around the world, and many places are in their second or third lockdowns. It is vital that we keep safe, avoid mingling with others outside your households, and don't get together to socialize with those outside. Use the phone or Zoom instead. Keep home as much as possible, and always wear your mask when outside. We are approaching the 1-year mark of this pandemic, but the home stretch is in sight. One of the questions that frequently arises is about the safety of the vaccines. Millions of people have now received the vaccine worldwide with no serious side effects. Let's take a look at this video from the Government of Canada to better understand how these vaccines were produced with high safety standards in a short span of time.
Vaccines are the most effective way to prevent the spread of infectious disease, but developing one can be costly, long, and complex. However, with significant investment and collaboration at a global scale, developing a vaccine is possible in a much shorter period of time. So how are vaccines developed today? And will the development of a COVID-19 vaccine be different? All vaccines go through 3 basic stages of development: the exploratory stage, the preclinical stage, and the clinical stage. In the exploratory stage, scientists do basic laboratory research to find vaccines that can help us develop immunity to a disease before being exposed to it. On January 11, 2020, the genetic code of the virus causing COVID-19 was published. This allowed scientists all over the world to start working on finding potential vaccines. With more than 150 in development worldwide, scientists are using current approaches like using whole or parts of killed or weakened virus, and newer techniques such as delivering COVID genetic material directly into cells. In the preclinical stage, scientists use laboratory and animal studies to identify safety concerns before testing the vaccine in humans. It is also used to help find the safest dose. While many vaccine candidates don't progress beyond this point, successful ones move on to the clinical stage, where they are first tested in humans. This stage normally consists of 3 phases. Phase 1 trials involve a small number of healthy volunteers to test safety and confirm that the vaccine causes an immune response. An immune response refers to how our body recognizes and defends itself from viruses and other potentially harmful substances. Promising vaccines then progress to Phase 2, where they're given to hundreds of participants, including groups at risk of the disease. The goal of Phase 2 is to test the vaccine's safety, the proposed doses and method of delivery, and again, to assess the immune response. Phase 3 studies involve thousands of volunteer participants and compare groups that received the vaccine to those that didn't. These studies are used to further answer whether the vaccine works and still demonstrate that it's safe for use. One way scientists have worked to reduce the time to develop a COVID vaccine has been to use study designs that allow merging of clinical phases. For example, new approaches have allowed for Phase 2 participants to be included in larger Phase 3 studies, allowing scientists to shorten the overall timeline and number of participants needed, without cutting corners or compromising safety. The first COVID-19 vaccine trials in humans started in March of 2020. Since then, tens of thousands of volunteers have been enrolled in clinical studies worldwide. Health Canada, responsible for regulating the use of vaccines in Canada, has authorized clinical trials for COVID-19 vaccines. Before approving a new vaccine, they look closely at all the data on it, paying very close attention to its safety. Many vaccines will fail somewhere along this path if they don't work or are unsafe. It's normal, and this is the purpose of all the stages of development and clinical trials. Only those that are proven safe, effective, and of high quality will be approved for use in Canada. A safe and effective vaccine will bring us one step closer to the widespread and long-term management of COVID-19. Visit canada.ca/coronavirus to learn more.
Thank you for that. And let's continue to remember the guidance of Maulana Hazar Imam. I would like my Jamat to be guided by the advice and directives of their health authorities to benefit from the protection these vaccines will provide. We end our show tonight, as always, with our much-loved musical expressions. Thank you for being here with me today and wishing you all the best for 2021. Thank you for watching, and Ya Ali Madad.
नस्ल दर नस्ल क़यामत की कपत तागोनानो बोनिका है सिफत तागोनानो बोनिका है सिफत कराशिरुनो को तनो मानको कराशिरुनो को तनो मानको शुमसुम जमी को एक बार तादत शुमसुम जमी को खुशानी बोझे हो सावे सफो ताहर अल्फाज मोहब्बत चिग्यार मदीनात जनु यार दुनिया चुबासो जम कसुंबोय जमी को दुनिया चुबासो मुख्तरम हसे इंसान रे को बश ना 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 का जिंदगिया कोस्ते गम की नो प्राय का जिंदगिया कोस्ते गम की नो प्राय तू खुशानी बोझे हो सावे सफो ताहर अल्फाज मोहब्बत रचियार मदीना जनु यार दुनिया चुबासो जम कसुंबोय जमी को दुनिया चुबासो Safo tahar alfaz